Well, as nursing shortages and strikes continue, there is some uncertainty about whether the number of new registered nurses being produced will be enough to meet future demand. This comes from a new report out of Albany that examined the nursing education pipeline here in the state of New York. And CBS 6's Lara Bryn dug into the numbers.
This line graph shows registered nurse graduations in New York State, and as you can see, in recent years, that red line is moving down.
There were slight drops in the number of graduates in 2022, 2023, like maybe 300, give or take. And we're like, oh my God, is this a trend? We really don't know.
That's something Dr. Jean Moore at UAlbany's Center for Health Workforce Studies is looking into. With all the nursing shortages and strikes, she's been studying how, if at all, the nursing education pipeline is contributing to these problems. The center recently released a report which found not only did graduation rates decrease from 2021 to 2023, but 42% of reported participants turned away qualified nursing school applicants in 2023. And both of those things may be happening for similar reasons.
You know, the two things that they talk about a lot are difficulty recruiting faculty and also lack of clinical training sites.
The lack of clinical training sites peaked during COVID when Moore says hospitals couldn't take in nursing students for training because they were dealing with too many sick patients. That meant
students who were in training didn't have as much patient contact.
Which meant trouble with nurses establishing interpersonal relationships. The state has dealt with the lack of clinical training sites, at least in part, by okaying about a third of student clinical nursing hours to be done through simulation with augmented reality. The new UAlbany report has other suggestions for schools to better recruit and retain students and faculty.
If hospitals felt like they could spare the resource, having their experienced nurses serve as adjunct faculty, be great.